All right, Christine, thank you so much for being on the podcast today. You have been my pelvic floor physical therapist. And so I am so happy to, share you with our audience so they can learn more about their bodies and why they need pelvic floor PT. So, but anyways,
Yes.
tell us just who you are and, where you live, who you are as a person.
Yes. Thank you so much for having me. This is exciting. I love your podcast and
Thank
I
you.
love just the focus of being healthy, staying healthy, and just taking these steps to stay that way. So my name is Christine Klein. I'm from New York, but I've lived in Brevard County, Florida, where we are since 1999. Moved here with my
Oh,
family.
yeah.
Um, yes, and then I've been a physical therapist since 2006. I went to UCF, and then I got my doctorate degree from Regis University in Colorado. It was
Okay.
online. I had to go there a few times, but it was mostly online. I did that while I was working,
Mhm.
which was pretty cool. So I got that in 2009.
So you
And
were, oh, sorry, I didn't mean to interrupt you because PT, the same thing has happened in with nurse practitioners. You were a physical therapist with a master's degree, right?
yes,
And then they've changed now where it's only DPT, right?
now it's
People
just
probably don't
DPT.
care about that.
I was the last master's class to graduate in
Uh,
2006.
yeah.
So
So I'm the same. I'm a master's prepared nurse practitioner, but now nurse practitioners that come out of school have some kind of EDD,
level. Yeah.
BNP, PhD, something like that. Yeah.
Yeah. Yeah. So 2007, they were all doctors of physical therapy.
Yeah.
So just around that time, we were able to kind of, in a way, grandfather in kind of, sort of. It was like a
Mhm.
transitional doctorate is what they called it. So it
Got it.
still took 2 more years.
Got it.
Um, School plus work. I was like, let's get this over with before I get married and life,
Yeah.
and while I have the time.
Yeah.
Um, so I did orthopedic physical therapy until 2015.
Hmm.
And in 2015, I took my first pelvic floor physical therapy class.
Okay.
And then the floodgates opened of women's health and men's health, pelvic health. And I was just like, let's go. I took every class
Yeah.
I could. And I basically knew I was going to focus on it
Hmm.
exclusively. So I went on to study for the American Physical Therapy Board of Women's Health Clinical Specialists.
Hmm.
So they have certifications in orthopedics, geriatrics, pediatrics. I have the one for women's health.
Got it. Got it. Okay. What did you find there was a need in your ortho clients? Is that what led you to do the P like what was the like, let me check this out and see if
It was actually very interesting. We had on our intake forms, we have questions about incontinence and questions that would relate to pelvic health, but
yeah.
I never really thought much about it. I never thought I would do pelvic health at all.
Yeah.
It was never a thought on my mind. But my kids were born in 2011 and 2012.
Hmm.
And I was working in a clinic with another pelvic floor therapist at the time. And so I started to try to get back into working out, and I worked in a gym. So I would run on the treadmill at lunchtime. And I started to have kind of like orthopedic pelvic issues and pain. So I would consult my coworkers, as you
Yeah.
do, as a physical therapist. And so the pelvic health therapist, she said, Christine, just take a pelvic floor course. I think you would love it. I think you'd do really well with it. So that was my foot in the door to pelvic health.
Wow. Wow. Isn't
So
it so funny how we fall? Like, I feel like some of my journey, my career, it's like been just little, like, let me try this out. Let me check it out.
yeah, so it was more like a personal kind of thing. Like I could do
Yeah.
this to help myself, but then I
Mhm.
can also help so many other people.
Yeah. Got it. So if somebody I know in if somebody maybe hears pelvic floor physical therapy, they may be like, what is going to happen? Like,
Yeah.
what is actually physically happening to my body? So what is pelvic floor PT? Maybe just layman's terms.
It's basically physical therapy, but with a focus on everything that happens within the pelvis,
Hmm.
but the rest of the whole body affects what happens in the pelvis as well.
Yeah.
But long story short, if you have an issue with your bladder, with your
Uh-huh.
bowels, with pain related to the pelvis, so pain with sex, pain with pelvic exams, stuff like that, pelvic organ prolapse,
Yeah.
constipation,
Can
those
you
are
say what prolapse is? Just maybe if somebody doesn't know what prolapse is.
Yes, so prolapse is when pelvic organs start to descend down the vaginal canal.
Hmm.
So the bladder can press into the front of the vaginal wall, the rectum can press into the back of the vaginal wall, the
Hmm.
uterus can descend down the vaginal canal. And
Hmm.
so usually this is usually people will say, I was just washing in the shower and I felt something in the vaginal canal and I freaked out and I called my doctor. And then, they get the diagnosis of pelvic organ prolapse. And then
Hmm.
they hear, you can go to physical therapy for that. And then they're just flabbergasted, like, what do you mean I can go to physical therapy for that?
Yeah. Yeah.
I think it's becoming a bit more well known now, but a lot
Mhm.
of times people are very much caught off guard.
Like I didn't even know this was a thing, right?
Yeah.
Yeah, yeah. So, and you mentioned, I'm glad that was going to be my next question. Like, what would be some signs that you could benefit from pelvic floor PT?
Well, I
Mm.
think everybody could benefit from pelvic floor PT.
Yeah.
um, just to learn now
Yeah.
how to use your body to prevent these issues from happening in the future.
Yeah.
But the other big things is just like thinking that certain things are normal, like
Hmm.
even just like, I haven't pooped for a week. Okay, that's not normal. Or
Yeah.
leaking. Any type of urinary leakage is not considered normal.
Yeah.
So you may leak after a vaginal delivery, let's say, because
Yeah.
those muscles just went through trauma.
Hmm.
But don't think that that's going to be the rest of your life and then you just deal with it forever. There's stuff that you can do to
Yeah.
get rid of that.
Yeah. That's awesome. I was kind of joking to myself. I was like, what should we name this podcast episode? And I was like, maybe peeing yourself is not normal. Like, PSA, because I remember like talking to like a family member who's had four kids, three of them were vaginal deliveries, and like, oh, that just happens, and it just takes years to, mine got better eventually, and I was like, that's not normal.
Yeah. So it's just that little bit
Mhm.
of education can help you for
Yeah.
the rest of your life.
What's common is maybe not necessarily normal.
Yeah.
Yeah. Got it. Got it. Okay. So you were saying everybody could benefit from some pelvic floor PT, because I'm sure there's probably things that we can do to prevent issues, but then obviously some of the problems that you've mentioned, like that, you obviously PT can be beneficial for you if you do have prolapse or leakage or issues
Yeah.
like that. So what are, just to give people a picture, they're like, okay, I need pelvic floor PT, but what's actually going to happen? Like, what does a session, with you look like when somebody comes in for their first session? Like,
Yeah. So I actually made a video about this,
oh,
and you
awesome.
can access it for free on my website. Um,
Wonderful.
Links I know will be included in the notes for the show.
Yeah.
Because yeah, it actually keeps people from getting care because they're
Yes.
scared, they're worried about what's going to happen in that visit.
Yeah.
So I can only speak for myself. I don't know what happens in other pelvic floor physical therapy clinics,
Sure.
but we have an hour in my clinic. The
Hmm.
intake forms are pretty long. So I'm
Uh-huh.
asking all these questions so I have a good solid background of what's going on.
Hmm.
So I know what to ask you in the session. But it starts with a conversation.
Hmm.
And a lot of times people really are able to just open up fully in that
Yeah.
first visit.
Hmm.
If they have a history of trauma or abuse, sometimes I'm the first person that they tell that to.
Wow.
It's just amazing to me. It's like giving me chills right now.
Hmm.
Um, but that's so important to work through some of the issues that people are dealing with. So
Yeah.
it's a big long conversation
Yeah.
in that first visit.
Hmm.
Then I'm going to teach you what's normal for the bladder, normal for the bowels,
Hmm.
because usually just knowing that stuff, even if you think you don't have an issue
Hmm.
currently, you might, and that might be contributing to what's going on.
Yeah.
So over all that info,
Hmm.
then we'll focus on, um, problem specific things. So if you're there for prolapse, of course, we're going to talk about that. If you're there for pain specifically, we go over that.
Hmm.
And then the physical assessment, I usually start by checking breathing to see if
Hmm.
you're breathing just in your chest, really shallow, or if you can breathe deeper and get your
Hmm.
deep core muscle system firing,
Hmm.
basically activated and just become aware of it. And I really shove a lot of stuff into this first session
Yeah.
because I'll try to check the abdominal wall, your ribs, your hamstring and your hip mobility, muscle balance of the glutes and the
Hmm.
hamstrings, thoracic mobility, and then I give you homework.
Yeah.
Oh, and I do a pelvic floor muscle assessment.
Uh-huh.
Like, okay, so if the person that I see is comfortable with it,
Mhm.
we are trained specially to assess the pelvic floor muscles internally. So that's why
Mhm.
we take so many extra classes for pelvic
Yeah.
floor therapy. We don't just learn this out the gate in physical therapy school.
Mhm.
So, vaginally, it's not like a gynecologist office. There's no
Yeah.
stir, there's no speculum. It's one
Mhm.
finger assessing the pelvic floor muscles vaginally and
Mhm.
or rectally. So
Mhm.
we do work with men as well.
Okay. Got it. Got it. Yeah. I was going to say just from experience, right? Because I'm thinking of too, just my background in family practice. I know that I have had patients who like a pap smear is, just very, like I just saw different things, just very small, issues like that. I can imagine if things like that are very painful for you, like the thought of doing PT could be like, I'm not going in there. It's gonna hurt.
Yeah.
So knowing it's one finger going in and just testing the muscles quickly, it's not painful. It's not, yeah, your legs aren't up in the air like at the
Yeah.
OBGYN.
And
It's
we really do take our time. I don't
mhm,
do that with everybody on the first visit. And sometimes I
mhm.
never do it
Yeah.
because the person's just not comfortable, or maybe it's really not even necessary, but
Mhm.
it is helpful to know what those muscles are doing
Yeah.
and just being able to connect to those muscles in your brain
Mhm.
so that your homework's that much more effective.
Yeah, wonderful, wonderful. I'm curious, just speaking to, my demographic is kind of, I would say women probably in more of their 30s or 40s. So they may be hitting that perimenopause stage or could be young, could be late 20s, postpartum, something like that. I'm curious how common is like do you see pain, like painful intercourse and things like that? Because I think I always think stuff around sexual health we might not feel comfortable talking about. And maybe knowing like how common something is or like do you know what I mean? I
Yeah.
don't know if maybe just my upbringing or how I was raised. I just know I have friends or people that I know that are kind of don't talk about those things. And I wonder if they could be getting help um if they were to kind of explore that more, learn more about that.
Yeah, I think sometimes people may think that they're alone in what they're dealing with. Like, oh, I'm the only person who can't have sex with their husband or who is married and has never, been able to have sex because it's so painful. So I see a
Mhm,
lot of people with pain, and a lot of times there's a syndrome associated with it.
mhm.
Um, like vaginismus is a condition where the muscles are tensing up uncontrollably.
Okay.
So there's a lot of stuff to work through with that, but even with syndromes like that, you can overcome them,
Yeah.
but it's really common. And then there's other pain syndromes like pudendal neuralgia, where
Okay.
the pudendal nerve is affected, and it can cause like searing, burning pain vaginally and rectally.
Mhm.
It's horrible, honestly, and a lot of people don't really know how to treat it very well
Yeah.
or
Yeah.
manage symptoms. So I hope that answered your question.
Yeah. Yeah. I mean, that these things really can be happening and it's not necessarily, or even like your fault, yeah, I know that there can probably be a lot of, I don't know, just, yeah, if that's affecting your relationships, or maybe
Yeah,
preventing you from being in a relationship,
yeah.
because of that. I just think of, do you see much with, and this is just purely my curiosity and things coming up. What about, like orgasms and stuff like that? Just, I
Yeah.
mean, how does that come
Tell
in to play? Yeah.
Some people will tell me, get a little more into the details of, well, I've never
Mhm.
been able to have an orgasm and blah,
Mhm.
blah, blah, blah. And so sometimes, yeah, that can be muscular related. And since we are
Uh-huh.
working on muscles to try to restore, overall, we want to restore a normal tone. And we
Yeah.
just want to be able to get those muscles to effectively squeeze and relax.
Mhm.
So once
Okay.
we can work through things like that, things like orgasms might end up better, or you might like have the
Mhm.
first one ever.
Yeah.
So yeah, so just basically working on, it's not like, I don't know. I'm sure not everybody tells me the details about that
Yeah. Yeah.
aspect of things,
Mhm.
but some do for sure. And I
Yeah.
hope
Yeah.
that I'm creating a safe enough space for people to be able to talk to me openly and honestly, because that's how we'll get the best results.
Yeah, definitely. Definitely. So, and to kind of reiterate just a point you made. So basically, you said you're training the muscles, trying to get the muscles to be able to contract and relax, and it, like kind of breaking it down. There's times where people have contracted muscles, tight muscles that are causing problems. And then there's times where people have to relax the muscles that aren't contracting enough, right? Is that a
Yep.
good way to break it down?
Yeah, basically, I think of it like a pendulum. Like you're either these
Okay.
muscles are really tight and shortened, and then when we have a tight, shortened muscle, that muscle's actually weak and it's not doing its job. So that can cause symptoms of leaking and prolapse and all of these other things that we think is just associated with a weak, overall weak muscle or like a
Mhm.
lengthened muscle.
Yeah.
And so a lot of times people are like, well, pelvic floor therapy is just Kegels and I'm just going to do Kegels, or I did Kegels and they didn't,
Yeah.
because that muscle is stuck in a tense, tight, shortened position. Uh,
Yeah.
yeah, so we've got
So
to first,
tightening it more isn't getting you results.
it's not going to help at all. Like if your bicep muscle is stuck in a bent position and we try to tighten it more, that's not the solution.
Yeah. Yeah.
But
Hmm.
then some people have very weak muscles and they can't
Uh-huh.
even really feel them or connect to them enough to elicit
Mhm.
a contraction. So
Got it.
then, yeah, just a different way of working on things
Uh-huh.
muscularly.
Got it. Got it. Awesome. Yeah. Yeah, I'm glad you brought up Kegels because I think that's probably I'm thinking of because I'm 14 months postpartum now. That's just kind of the world, my brain, even though I'm postpartum, I'm probably nearing perimenopause here in the next year or two. But I think that's something that women do here, and I want to say I feel like I've been told, or I'm sure women are told, oh, just do Kegels, and that's so that not isn't necessarily a fix for everything.
No, definitely not. Plus, it's like, well, how are you doing those Kegels? Because I'll check
Yeah.
someone's strength and I'll say, okay, go ahead and do what you feel is a Kegel. And they are lifting up into a bridge, tightening their thighs,
Uh-huh.
or they're bearing down, so it's
Yeah.
just actual pelvic floor muscle contraction.
Okay.
Some people come in and they say, well, I've been taught to just do Kegels while I'm peeing. And no,
Oh.
we don't want to be doing that. We don't want to be stopping the flow of urine while
Uh-huh.
urinating.
Yeah.
Not a good time to practice,
Yeah.
stuff like that. So it's just kind of busting these myths and
Hmm.
then teaching you how to actually use your muscles
Hmm.
and with what kind of activities should you be using this muscle group with.
Yeah. Yeah. Got it. And I know for my experience, like you were giving me sometimes like stretching or like strengthening things for, we're not just focusing on the pelvis. Like it might be an exercise for my glutes or for my hamstrings, or like it's, kind of like you said, it's a full body. Like those pelvic muscles are affecting other things too.
Yes.
By the way,
Yes.
my hip pain has been so much better
Oh, good.
from our session last week. So
Awesome. Yeah. So that I check hip alignment to
mhm.
just make sure that, one side is not basically that things are lined up the way they should, because that helps your pelvic floor muscles work at their most effective, um, in their most effective position.
Yeah.
And then we need to be able to breathe and have good rib cage mobility to help our pelvic floor muscles work their best. So,
Yeah.
yeah, we need strong glutes and hips and flexibility here and there to help support everything. It's not just about a strong pelvic floor.
Yeah. Yeah. Got it. And I love you mentioned like the connecting the breath and how
Yeah.
much like we should be paying attention to our pelvic floor when we're breathing too. Hmm.
Yeah.
So, and it sounds like, if somebody's having issues that we talked about earlier, they're having leakage, they're having pain, I think that's a great time where getting an assessment and working with somebody to figure out exactly what's going on, is appropriate. So coming in, to work with you, or if they're not local, somebody that's local to them. But what are maybe some things that somebody could do? Maybe somebody is pregnant and they're worried about having leakage postpartum or something like that. What are things that we could do to be preventing issues in the future?
As a pregnant person?
Or just in general, maybe, like I'm thinking of just examples. Like I have a family member that had a hysterectomy in her 30s,
Mhm.
right? So I mean, I would think, having surgery down there and like, because postpartum, you're at increased risk for prolapse, right? Or not postpartum, gosh, hysterectomy, are you at increased risk
Yeah.
for prolapse?
Usually, yes, because you're losing a
Going in
little
and
bit of structural support within the
okay.
pelvis have a hysterectomy. So, even just having a visit with a pelvic floor therapist to learn that and to learn
Yeah.
pressure management in your system so that you're engaging your muscles
Hmm.
with exertion. So when you go to lift something, you're not holding your breath and bearing down. When
Yeah.
you're sneezing, you're not just letting that all flow through your pelvis. You're
Yeah.
fighting that pressure with your muscles,
Hmm.
and making that pressure move up and out of your mouth. So that's
Hmm.
usually something I teach everybody the first day.
Uh-huh.
There are a
Got
lot
it.
of little things that you can do to help prevent issues.
Okay.
So that's
Mhm.
definitely one of them is pressure management. And that's not just for pelvic organ prolapse, that's for hernias and herniated discs in the spine.
Oh, wow. Yeah. So that could be, yeah. A lot of people can apply apply that for sure.
Everybody can, for sure.
And that just made me think I should have asked this question first, but like who would be at increased risk for having pelvic floor issues? Like surgery or, I think we think of having babies, but what about in men, like how are men at increased risk or women who aren't necessarily postpartum or have had babies? Like what are factors that might predispose them to pelvic floor issues?
There's a lot of different factors. There are genetic factors at
Okay.
play. So
Hmm.
prolapse can be a genetic issue as well. There are some
Okay.
connective tissue disorders that can make a person more at risk for prolapse.
Hmm.
Ehlers-Danlos syndrome, that
Hmm.
connective disorder is one of them. So yeah, number of pregnancies, even if you have C-sections, you're at risk for pelvic floor issues. It doesn't
Okay.
have to do with the vaginal delivery.
Hmm.
Um, let's see. I just worked with somebody who is a male who came in with diastasis recti. So
Okay.
abdominal separation, and wasn't he was doing crunches in the gym and he wasn't activating his deep core muscle system
Hmm.
first and then doing his crunch. So that's learning how to use your deep core muscle system
Yeah.
and adding in the rectus abdominis and adding in the obliques. So that was
Hmm.
pretty cool. I also see a lot of older women with diastasis recti.
Okay.
It can come from straining. So let's see.
Like straining to have a bowel movement.
Straining to have a bowel movement or like chronic coughing over
Okay.
time can lead
Hmm.
to issues for sure. And then, I mean, I've worked with women who have never been pregnant or had a baby and have prolapse.
Uh-huh.
And it's kind of just a repetitive thing that happens over time. So she
Mhm.
worked as an airline person
Uh-huh.
and was constantly lifting heavy luggage overhead. So the way
Okay.
doing that predisposed her to prolapse.
Got it. Got it. Got it. So yeah, I'm thinking of like my small kids, like my kids teachers that are, might be picking up little kids all the time or something, or
Yeah.
nurses. Gosh, I worked in
Oh,
the ICU for years, physical therapists, where you're transporting patients or, things like that. So maybe jobs, occupations where you're more physical like that could be
oh,
a
definitely.
risk
A lot
factor.
of times I'll see police officers wearing that heavy belt
Oh,
around and
uh-huh.
also not getting a chance to pee when they need to pee.
Yes.
Doctors, nurses, police officers, mail carriers,
Yeah.
like Amazon delivery people.
Yeah.
Uh, so literally everybody would benefit from pelvic floor
Yeah,
therapy.
there we go. Again, everyone would benefit from pelvic floor PT. Oh,
So when I took my first course though, and I learned all these things, I was like, oh my goodness, because I was doing everything wrong when it came
yeah,
to habits. It's like, I don't have time to pee. Let me just force this out, go really quick. Let me not
yeah,
sit down on this restroom seat. That's disgusting.
uh-huh.
Stuff like that. Because we don't want to hover. We don't want to
Hmm.
pee just in case.
Got
Those
it.
things we teach our kids when they're little. So these habits start young.
Yeah. I thought of that because we're potty training my son right now, and they're like, because he does better at school than he does at home. He like doesn't want to, but I'm trying to do the sticker chart and like pee pee in the potty and stuff. And that like the advice I've gotten is like you have them go pee every, sit down on the potty every 30 minutes and then every 45 minutes. But then that is having them pee when they don't necessarily have the urge,
Yeah.
right? Which is
Yeah.
not
That might
what
be a little too much. That I would think that might make their bladder a little more sensitive,
uh,
kind of make them have to pee more often than usual.
okay.
I honestly, and I don't have it, I haven't like researched this to back this statement up, but
Sure.
way that I talk to my kids now, I'll remind them, like if we're leaving, I'll say, hey, do you feel like you need to use the bathroom? Because
Mhm.
sometimes they'll just ignore it.
Yeah.
Uh, if they do, fine, go. If not, I'm not going to force them to go before we leave the house.
Yeah. Got it. Yeah. Just if you have or yeah. And that's what I think we probably need to do is start like, I know a lot other people do that, have the potty, like the little potty chair in the car with you so that you have, because that's what we find is like then we're out at a restaurant or something. Although he did just go on the potty, in the restaurant the other day.
Oh,
So
good.
yeah. Yeah.
Having a
So
potty chair in the car can be helpful.
yeah. That's what my in-laws did. They came down, my sister-in-law and her husband, it was a long drive. They drove down from Illinois and their daughters were potty training. So they had the potty chair in the car with them. So, they've got a potty and they're in the middle of, a highway somewhere. They can just
Yeah,
pull
that's so
over and they have the potty chair.
I feel like potty training is kind of a different beast
Yeah.
versus the other habits that can form over time.
Yeah. Got it.
So
Got it.
good luck with potty training.
Thanks. Thanks. So, okay. So if somebody is, let's talk about if somebody's local or maybe if somebody's not local. So if somebody's local, they're here in Brevard County, they want to get, come see you, get connected with you. How do they do that?
So my clinic is in Rockledge and
Uh-huh.
the name is Embrace Health and Rehab.
Mhm.
So they can visit my website, which will be listed, and
Yeah.
call or text me. Everything goes straight to me or send me an email. There's a contact us page on my website.
Got it.
A lot of different ways you can get in touch with us. And I just want to throw this out there too. So we do take Medicare, but
Okay.
that's all that we take.
Okay.
So we're out of network with insurances. And it's not because I haven't tried. I have tried to get in network with everybody,
Yeah.
and they will not let me in network. And
Cover
it's
it.
a thing with private practices where it's just really hard to
Oh,
network.
yeah. Well,
But the
I
beauty of that,
found, oh, I'm sorry. I didn't mean to interrupt you.
oh, that's okay. I was just going to say the beauty of that is we get more time
Mhm.
with person. And that's why I opened my clinic anyway, so that I had
Yeah.
that necessary time, not
Mhm.
a short, quick 30-minute visit that, someone comes in late, paperwork's not done. Here you
Yeah.
are for 10 minutes. I can't do anything in that time.
Yeah.
Uh, so I'm just throwing that out there. All the information again is on my website. Uh,
Yeah.
and yeah, so all my social media links as well.
Yeah, you're on Instagram at Dr. Christine Klein, which again we'll link. I was gonna say, just mention just on a personal standpoint, I know because my OBGYN referred me to Health First, pelvic floor PT, and I never went, like it just didn't work out that I always like didn't have childcare and but even still with I think we had insurance coverage through there, it was still like $150 for the initial consultation,
Mm-hmm.
which my understanding is you're not necessarily getting the time and attention, that I did with you. And
Right.
I was able to use my HSA to purchase and you do bundles, like where
Yes.
I did a package of 4 visits with you and I paid for it with
Yes.
my HSA.
Yeah.
So, I
So
mean, there's
the
options,
There's
you know.
definitely options. HSA, FSA we take, and then the super bill you submit to your insurance company because it's not like we don't take insurance. You just have to kind of understand how it works.
Mhm.
So we use your out of network benefits if you have them.
Okay. Got it. Got it. Awesome. Awesome. And then, okay, so if somebody is listening to this and they're not in Florida, not in Brevard, not in Florida, how would
Uh-huh.
you said there's kind of some websites with some resources of maybe ways that they can start finding help, um,
Yeah.
closer to home or.
And if you're, truly interested and you don't live in Florida, I could do a virtual visit with
Mhm. Oh,
whomever.
awesome. Awesome.
Yeah, there
Mhm.
are there's a lot of information out there now for with free resources. So those links, they're fantastic and they will be listed in the resources for this podcast.
Yeah. In the show notes, we'll put them for sure.
Because not everybody can get to a pelvic floor physical therapist.
Got it. So on those websites, maybe there's some like educational videos and stuff that they
Yeah,
can.
there's videos, there's blogs. Yeah. And
Mhm.
I think it's mostly videos and blogs. I think you can
Okay.
search what you're looking for and it'll pop up.
Got it. Got it.
I have my own course in the works.
Awesome.
Yeah,
Awesome.
it will be
Uh-huh.
ready. And it'll basically be every little bit of information I know about pelvic floor therapy, um,
Just
all together.
packaged.
Yep.
Wonderful, wonderful. Awesome. Well, thank you so much for just telling us, educating us on all the things. And yeah, I encourage, especially if you're local here in Brevard County and you're having these issues that maybe you now know are not normal, even though you've been thinking that they're normal, you should go see Dr. Christine, and get some help, get to feeling better. So
Yes. Thank you.
awesome. Thank you. Oh, and you know what? One more thing. I'm sorry. You had on your website, forgot to mention this. You also have a perimenopause survival guide
I sure do.
and on there that they can check out. That's a free resource that they can check out,
Free
right?
resource. Yep. Perimenopause survival guide as I am entering that time of life. So now my focus is on that.
Yes. Yes.
And helping myself through that and helping everybody else in the meantime, as
Yeah.
well as a bladder and bowel health guide. You can find that
Awesome.
for free.
Perfect. All right. We'll link it. Perfect. All right. Well, thank you so much.
You're welcome.